everyone. Good evening to all of you. A warm welcome to all of you and our respected speaker, Dr. R. Karthikeyan. So, today we are back again with another informative and very interesting webinar we are having today. And the topic is role of homeopathic medicines in removal of renal calculi without surgery. And now it's time to introduce our today's speaker, Dr. R. R. Karthikeyan sir is a distinguished homeopath with a MD and PhD in homeopathy. With over 14 years of teaching experience, he is currently served as the Deputy Medical Superintendent. Since 1999, Dr. has gained extensive clinical experience and is a specialist in surgical cases. He has authored numerous publications and in esteemed homeopathic journals and frequently contribute as a resource person in various medical programs. He was also member of expert committee of community medicine subject, Homeopathy Education Board, National Commission of Homeopathy, NCH. Sir has joined as lecturer and promoted as leader and head of department and promoted as professor and head of department of community medicine, RVS Homeopathic Medical College from 16 June 2017 till date. And promoted as deputy medical superintendent from 17 April 2023 to till date. We are very inspired from you, sir.
Thank you.
And we are going to learn about the surgical cases tonight. We are very eager to learn from you, from your expertise, from your knowledge, and from your experience. So, sir, I would like to hand over the mic to you. So, please share your experience and your presentation with us.
Thank you. So first, I wish to thank Almighty the God for providing me an opportunity to present a webinar now. Next, I wish to thank Dr. Mansi Tyagi, DNHE Marketing Head and Editor, Homeopathy 360, for organizing this webinar. Next, I wish to thank all the doctors, faculties, medical officers, undergraduate students, postgraduate students, CRRAs of various institutions for their valuable registration to attend this webinar. Thank you. So remembering our father, so I would like to quote a Tirukkural. So actually, Tiruvalluvar is a divine poet. Everybody is aware because our Prime Minister will be quoting Tirukkural everywhere, even in Geneva speech. So the Quran is Tottane Thurum Manarkeni Mandarku Katrane Thurum Arivu. So the meaning of this Tirukkural is knowledge is no treasure to hold. It is a living spring that must be drawn daily with humility, practice, and sharing, or it will vanish into the sands of forgetfulness. So the purpose of this Quran in today's age of fast changing knowledge, fast-changing knowledge. This squirrel is a call to lifelong learning and intellectual humility. So just as the sand well demands constant digging, professionals, leaders, and citizens alike must keep updating, questioning, and sharing knowledge to remain relevant. So now we are entering into the topic. So the introduction of this topic. So the process of forming stone in urinary tract. So that is the kidney, bladder, and ureter is referred to as urolithiasis. So urinary calculi are one of the most common diseases of the urinary tract. So the urolithiasis comes under this ICD classification 10 and code number is N20 to 23, is a condition characterized by the formation of mineral concretions or stones within the urinary system. This urolithiasis affects about 12% of the world population at some stage in their lifetime. Urolithiasis or urinary tract stones are among the most common and painful diseases of human beings. This is the third most common urinary tract disease that may lead to renal failure. The overall probability of forming calculi varies in different parts of the world. So the risk of developing urolithiasis in normal adults appears to be lower in Asia, that is 1 to 5% only, than in Europe, where there is a 5 to 9%, and in North America, also 5 to 9%, and 12% in Canada, 13% in the US. The highest risk was reported in Saudi Arabia. As everybody is aware, it's a desert, so 20.1%. Then next is the racial differentials are also noted. So the blacks appear to suffer less frequently than whites. Coming to India, so in Indian population, about 12% of them are expected to have urinary stones, out of which 50% may end up with the loss of kidney functions. In India, approximately 5 to 7 million patients suffer from kidney stone disease, and at least 1 out of 1,000 of the Indian population need hospitalization due to kidney stone diseases. In the geographical region of India, so two distinct stone belts have been identified. So in North India, forms the first stone belt. Pehle parts of Maharashtra, Gujarat, Jabalpur, Madhya Pradesh में वो तो दूसरा stone formation का belt area. The structure and composition of urinary stone in India vary from that of the Western world. Calcium oxalate monohydrate stones predominate in India. So the calcium stones are predominant renal stones, comprising about 80% of all urinary calculi. In India, upper and lower urinary tract stones occur frequently, but the incidence shows wide regional variation. The incidence of urinary calculi is comparatively lower in the southern parts of the country compared to other parts. So with its multifactorial etiology and high rate of recurrence, urolithiasis remains a medical challenge. Various studies from India have also documented that calcium oxalate forms the major constituent of urinary calculi in India. The proportion of calcium stones may account for pure calcium oxalate, 50%. Then calcium phosphate, 5%, and a mixture of both calcium oxalate and calcium phosphate, that is 45%. Then this calcium oxalate monohydrate is the most thermodynamically stable form of stone. So calcium oxalate monohydrate is more frequently observed than calcium oxalate dihydrate in clinical stones. So this is the picture of the different types of kidney stones. So cystine stone, calcium stones, uric acid stones, struvite stones. So this is the pictorial representation or appearance of this different types of kidney stones. The chemical composition of urinary stones includes calcium oxalate, 60%, calcium phosphate, 15%, uric acid, 10%, then magnesium ammonium phosphate or struvite, 15%, cystine and others, 1%. So next is the age and the sex differentials in urinary stone formers are substantial. So it is more common in males of 30 to 40 years of age in the industrialized countries and in children under 10 years in the developing countries. So next we are entering into the causes. So first and foremost cause is dehydration. Everybody is aware of this dehydration and experience this dehydration. Next is the hypercalcemia. So next is hypercalciuria. Next causes hyperparathyroidism. So usually we will do this parathyroid hormone investigations for repeated stone forming persons or patients. Next is the hyperuricemia. Next is hyperuriclosuria. Next is hyperoxaluria. Next is the infection, cystinuria, renal tubular acidosis, polycystic kidneys, medullary sponge kidneys, etc. are some of the known reasons for the formation of stones. Renal calculi, often associated with the recurrent urinary tract infections or staghorn calculi. So these staghorn calculi are branched kidney stones extending into multiple renal calyces. So in many patients, metabolic defects are not found usually. Such are known as idiopathic stone formers. So this is the picture of a staghorn calculi. So when the urine becomes super saturated with insoluble materials because the excretion rates are excessive or because water conservation is extreme, the crystals form and may grow and aggregate to form calculi. So this urine supersaturation can be increased by dehydration or by over excretion of calcium oxalate, calcium phosphate, cystine, or uric acid. So as I already referred, so dehydration is the main reason. So this urine supersaturation can be aggravated or increased by reason is dehydration. So next we are entering into the symptoms. So until now, we discussed about the introduction of this renal calculi and the causes for this renal calculi. So now we are entering into this symptom part. So where how this renal calculi patients will express their symptoms. So the symptoms of kidney stones are related to their location, whether it is in the kidney, ureter, or urinary bladder. So, okay, so these three areas are there. So based upon the location or lodgement of the kidney stone in the kidney, ureter, or urinary bladder, the symptoms varies. So as everybody is aware that, so the size of the kidney is larger than the ureter. Okay, so when the stone is lodged in the kidney, so small amount of symptoms only can be expressed. So when it enters the ureter, so the diameter of the ureter is just 2 mm. So when it enters the ureter, automatically pain will be aggravated. So urinary bladder. So the signs and symptoms of the stone disease comprise of this renal colic. So the first and foremost is the renal colic. So next is the flank pain, followed by hematuria. So the blood is loaded in the urine. So then this location of this renal stone will lead to obstructive uropathy. Then if the stone is remaining in the tract ureter for a longer duration, so automatically it will provoke this urinary tract infections, secondary infections, bacterial infections. Okay, so then this blockage of urine flow can also occur based upon the size, and hydronephrosis also can occur. So these conditions, so there is this renal colic, flank pain, hematuria, obstructive uropathy, urinary tract infections, blockage of urine flow, and hydronephrosis. So will be associated with certain conditions. So these conditions may result in nausea and vomiting. So with associated suffering from the stone event. So apart from this renal colic, flank pain, hematuria, obstructive uropathy, UTI, so blockage of his urine flow and hydronephrosis. Along with this, the persons will definitely experience this nausea and vomiting because of this stone. So in general practice, acute renal colic is a common presentation. Once again, I want to stress you. So in general practice, acute renal colic is a common presentation. So the typical presentation of acute renal colic is intermittent. Colicky flank pain that may radiate to the lower abdomen or groin. So this intermittent colicky flank pain. So that is why it is intermittent is in certain positions. So it will not disturb the ureter, the stone. In movement and all, so the person is doing certain vigorous activities, stretching and all. So it will hurt the ureter. So only that renal colic is intermittent. Colicky flank pain that may radiate to the lower abdomen or groin. So due to this ureter, thereby this intermittent pain will be experienced by the persons or patients. So it is often associated with nausea and vomiting. as I already told you, so it is often associated with nausea and vomiting. So once a stone passes into the ureter, when it enters the ureter, the resultant obstruction may cause reduced GFR, glomerular filtration rate, and a renal blood flow leading to hydronephrosis. So as I already told you, so when the stone is lodged in the kidney, there is no issues, no major issues. So once a stone passes into the ureter, the resultant obstruction may cause reduced glomerular filtration rate and renal blood flow leading to hydronephrosis. As I told you, so when compared to the kidney, the ureter diameter is very small. It's a tube, so 2 mm diameter. So definitely it will create some obstruction. So that the resultant obstruction may cause reduced GFR and renal blood flow leading to hydronephrosis. That is the expected pathology. As stone enters the ureter, the lower urinary tract symptoms occur, such as dysuria, urgency, and frequency. So, difficulty in urination, urgency, and frequency can occur as the stone enters the lower urinary tract. So comorbid diseases, personal or family history of kidney stone, any anatomical defect, or surgery of the urinary tract are known to increase the risk of kidney stones. So comorbid diseases, that is a personal family history of kidney stones, any anatomical defect or surgery of the urinary tract are known to increase the risk of kidney stones. So that should be noticed. Urgent intervention is most often needed in acute obstruction. So after the symptoms, now we are entering into the investigations part. Okay. So before entering into the investigation, I want to just refresh this symptoms. So that is once again this renal colic, flank pain, hematuria, obstructive uropathy, UTA, so blockage of urine flow, and hydronephrosis. So it is associated with nausea and vomiting. So as I told you, it is acute renal colic is a common presentation. So definitely nausea and vomiting will be there. So then the patient will be rolling about with this pain. So because in one position he'll be better. So when he changes the position, he'll be finding it difficult. So he'll be rolling around with pain. So that is the presentation of this renal colic. So now we are entering into the investigations part. So in previous generations, centuries and all, a plain X-ray of the KUB was written. So previous generations, so 90s, 80s, 90s and all. So a plain X-ray of the KUB, kidney, ureter, and bladder region was suggested by almost all the practitioners. So nowadays, after there is 93 onwards, so this ultrasonography of abdomen is being done. So previously, this USG abdomen was done in only in capital cities. So nowadays, in almost all the nook and corners of different parts of India, it is available. So USG abdomen can be done, and still more advanced technique is CT. So computed tomography scan, CT scan can be used, suggested. So basically, so previous generation, they were suggesting this X-ray KUB. So current generations can opt for this USG abdomen basically. So if it is not clear, means we can move on to this CT scan. Still more precise, we can get the location, size. Okay, so everything about this renal calculi. So these are all the basic investigation required. So to identify a stone, the location of the stone, where it is located, kidney, ureter or bladder. So it can be identified easily with this X-ray itself. Still more current generation, we can opt for this USG abdomen. Then still more, as I told, if it is not precise and clear, we can move on to this CT scan. So this is a picture X-ray KUB. As I told you, this is X-ray KUB, kidney, ureter, and bladder of a person who is showing a renal calculi. So in this picture itself, so this is a head bone. So on the right side, so this person is showing a renal calculi. So next, after these investigations, so we are entering into this treatment part. So usually this literature has given that stones of less than 5 millimeter in diameter usually pass spontaneously. So just keep this sentence in your mind. Okay. So stones of less than 5 millimeter diameter usually pass spontaneously. So if you advise the patient to take sufficient amount of water intake, okay, so 2 liters of water per day is recommended. So like that, if you advise the patient to take adequate intake of water, so the small stones less than 5 millimeter in diameter usually pass spontaneously. Next is this stones of size 5 to 7 millimeter have a modest chance, 50% chance of passage. So based upon the type or variety of the stone enlargement. So 5 to 7 mm size of stones have a modest chance of passage. And the third sentence is those greater than 7 millimeter. So I want to stress it again. So those greater than 7 millimeter almost always require surgical intervention. So according to this literature, so the stones of less than 5 millimeter diameter usually pass spontaneously. Stones of size 5 to 7 millimeter have a modest chance, that is 50% of passage. And those greater than 7 millimeter almost always require surgical intervention. 9 to 10 millimeter stones are relatively large, may not pass spontaneously. So what it does is, and cause symptoms such as pain, hematuria, difficulty in passing urine, or urinary tract infections. So as I already told you, this discussed about the symptoms. This 9 to 10 mm stones are relatively large, so may not pass spontaneously. So they cause definitely this pain symptom, hematuria symptom, difficulty in passing urine or urinary tract infections. So these usually require surgical interventions. So once again, so this is the important part of this webinar. So the stones, keep this in mind, stones of less than 5 millimeter diameter. So I am stressing it again. Stones of less than 5 millimeter diameter usually pass spontaneously. Stones of size 5 to 7 millimeter have a modest chance, that is 50% of passage. And those greater than 7 millimeter almost always require surgical intervention. So 9 to 10, so more than 7. That is 9 to 10 mm stones are relatively large, may not pass spontaneously and cause symptoms such as pain, hematuria, difficulty in passing urine, or UTI. These usually require surgical intervention. So once the presence of urinary stones is confirmed, or it is confirmed based upon this X-ray, ultrasound, or CT investigation. If the presence of the urinary stones is confirmed and the location, size, and type are established. So this is the advancement in this modern technology. So when we are, as I just showed you this picture of X-ray KUB, so this location only we can rule out kidney, urethra, or bladder in that X-ray. But the size and all, they can easily give in this USG investigation and still more approximately in CT scans. So that is the advancement of this modern technology regarding this investigation part. So this location can be easily identified by X-ray KUB, but when you go for this USG abdomen and the CT abdomen, the size can be given in pinpoint and the type of stones are established. So this medical intervention comes into play that includes treatment by drug therapy, first choice, or surgical removal of stones. So now I am purely talking about allopathic intervention. So there is modern medical intervention comes into play that includes treatment by drug therapy or surgical removal of stones. So now in this treatment part, I am going to discuss only about this modern medical intervention, which comes into play that includes treatment by drug therapy or surgical removal of stones. Later, we'll enter into this homeopathy part. So, these parenteral narcotics have traditionally been prescribed for acute renal colic by modern medicine. So, the intervention includes NSAIDs, that is non-steroidal anti-inflammatory drugs, and opioids for relieving pain associated with urolithiasis. So the first and foremost symptom, as I already discussed, is renal colic. So the patient will be rolling about with this pain. So he wants you to relieve the pain immediately. So only they are rushing to the hospitals. So this allopathic intervention includes non-steroidal anti-inflammatory drugs and opioids for relieving pain associated with this urolithiasis. So regarding this, both the categories of drugs have been found to be equally effective. That is, the NSAIDs and opioids are equally effective. So although these non-steroidal anti-inflammatory drugs are known to cause potential gastrointestinal and renal side effects. So repeated intake of this NSAIDs are known to cause potential GAT side effects and renal side effects. So whereas this opioid analgesic require administration of anti-emetic agents. These opioids, when the person is advised these opioids, so they require administration of these anti-emetic agents. So as these opioids are known to cause nausea and vomiting, along with urinary retention, constipation, and respiratory depression. So these are all the common side effects of opioid usage and NSAIDs usage. So this NSAIDs are known to cause GAT and renal side effects. So whereas these opioids are known to cause nausea, vomiting. So for nausea, vomiting, definitely anti-emetic agent should be prescribed. So another side effect is urinary retention, constipation, and respiratory depression. So certain steroidal drugs are recommended as medical expulsive therapy for distal urethral calculi. So apart from this NSAIDs and opioids, steroids are also recommended as medical expulsive therapy for distal urethral calculi. Once again, in conventional medicine, erythroscopy, then percutaneous nephrolithotomy, and laparoscopy are some common approaches to deal with renal stones, apart from this medication. NSAIDs, opioids, steroids. So they opt for this ureteroscopy, percutaneous nephrolithotomy, and laparoscopy are some common approaches to deal with renal stones. And at present, so this ESWL. So ESWL stands for extracorporeal shock wave lithotripsy. So this ESWL is the first line treatment modality nowadays. So some drawbacks of ESWL, that is extracorporeal shockwave lithotripsy, which is the first line treatment modality nowadays. So it has certain drawbacks. That is, early hematuria occurs, then perinephric or nephric hematomas can occur. Then there is a requirement of the use of general anesthesia during several sessions of this ESWL, that is extracorporeal shockwave lithotripsy. So there is increased susceptibility to radiation exposure in pediatric age group patients, and a long-term increase in a serum creatinine and a total homocysteine due to renal injury, such as ischemia, reperfusion injury after first time ESWL. So certain renal damage is occurring because of this ESWL, first time ESWL, extracorporeal shockwave lithotripsy. So this medical expulsive therapy is used to allow spontaneous. So that is the word to be stressed here. So this medical expulsive therapy is used to allow spontaneous expulsion of moderately sized distal urethral calculi from the urinary tract. Apart from this, laparoscopic surgery and open surgery is recommended if needed. So once again, this treatment part. So allopathics have two choices, that is drug therapy and surgical removal of stones, which we have discussed a lot. So the limitation in the conventional system of medicine for treating this condition or the cost involved in the diagnosis with regard to the type of stone, metabolic disorder, invasive procedures, and side effects of the medicines. So certain these are all the limitations for opting for this conventional system of medicine for treating this renal calculi. So next, we are entering into our system of medicine, that is homeopathy. This homeopathy can be used as a safe alternative to surgical intervention. Homeopathy has a holistic approach toward surgical diseases like renal stone. They are considered to be an affection of the constitution rather than a local problem. Homeopathy treats the chronic cases, including urolithiasis, with the holistic approach where we follow the principle of law of similia. besides the constitutional or individualized treatment, appropriate homeopathic organ-specific medicines selected on the basis of the important particular symptom can also be effective. So, two opinions and representing in this slide itself. One is the holistic approach. Constitution is targeted based upon the principle of law of similia. Besides constitutional or individualized treatment, pathological prescription is also equally effective. So the method assumes that certain remedies have a specific affinity for certain organs. So there are patients in whom it is desirable or necessary to treat specific organs or system in order that the whole person may be properly cured. Organopathic prescriptions are made based on the Paracelsus principle that the given drugs affect given organs or parts by self-elective preference. Many doctors have given in their experiences on the importance of selection of organopathic remedies. So, to quote some remedies, so many homeopathic remedies such as hydrangea, arborescens, Berberis vulgaris, Ocimum canum, Lycopodium clavatum, and Sarsaparilla are well-known medicines for treatment of calculus. So now I'm entering into this cured cases part of this webinar. So the studies suggest that treatment with homeopathic medicines has positive response in dissolution or expulsion of calculi. So once again, I want to repeat this sentence under the cured cases session. The studies suggest that treatment with homeopathic medicines has positive response in dissolution or expulsion of calculi, which is the ultimate what the patient is wanting for from us. So this is an example of a case report. So a 15 millimeter urinary calculus expelled with homeopathic medicine is a case report. So think of the size of the renal calculi. So already more than 7 suggested for surgery. So, but here is a case report. A 15 mm urinary calculus expelled with homeopathic medicine, the case report. So it is done by this Department of Materia Medica and Department of Practice of Medicine, Nehru Homeopathic Medical College and Hospital, New Delhi, India. So case summary, say case of 15 millimeter calculus lodged at the right uretrovesicular junction, presented with symptoms of severe cutting pain extending downwards from the right lumbar region to the right groin area. The patient had severe pain at the conclusion of urination. Another calculus of size, 10 mm in the lower calyx of the left kidney and 3 to 4 mm, 3.4 mm concretions in the right kidney was also detected. So apart from this 15 mm calculi in the right UV junction, so 10 mm in the lower calyx of left kidney and 3.4 mm concretion in the right kidney was also detected. So 3 case stones. So the homeopathic medicine Sarsaparilla was given on the basis of totality of symptoms for 3 days. The pain reduced in 3 days, and subsequent to an acute colicky pain and some bleeding, on the 11th day, the stone was expelled. So this case report shows the potential of homeopathy in case of large urinary calculi. This is an evidence to show to this world that a 15 urinary calculi was expelled with a homeopathic medicine named as Sarsaparilla. So next it is an original article. So there is a Lycopodium clavatum for the management of urolithiasis. So it is a randomized, double-blind, placebo-controlled trial. So done by CCRH, okay, Central Research Unit, New CCRH, New Delhi, then Siliguri Central Research Unit. So proving unit Bhubaneswar, Odisha, then Regional Research of Institute of Homeopathic, Kolkata, West Bengal, Homeopathic Drug Research Institute, Lucknow, UP, then Regional Research Institute, Shimla, Himachal Pradesh. So a that is the materials and methods, the multicentric, randomized, double-blind, placebo-controlled trial was conducted. So the patients having symptomatology like Lycopodium clavatum were enrolled after screening and repertorization as per the inclusion and exclusion criteria. So during the acute renal colic, despite a group allocation, the patients were either prescribed the indicated homeopathic medicines or conventional medicine. The analysis was carried out with an intention to treat approach, and missing values were handled using last observation carry forward method. So the result is, so there was no statistical significance between the groups. So in reference to the number of cases in which stones expelled during the trial, the mean size of the single stone expelled was this much value, and the placebo this much value. Then there was also no significant difference in the mean size of multiple stones. So conclusion is this, say future studies with the pragmatic study design and individualized homeopathy can be undertaken to assess the effectiveness of treatment in urolithiasis. Okay, so this verified syndrome of Lycopodium clavatum has been observed. So further research can be done based upon this Lycopodium. So next is the case report of a case of multiple urinary calculi treated with homeopathy. So this is done in a Central Research Institute for Homeopathy, Kottayam, India. So a case of multiple urinary calculi, so with size varying from 5 to 7 millimeter in the left kidney and 4 to 6 millimeter in the right kidney, a 13 millimeter stone in the left lower part of the ureter, and a 20 to 13 millimeter stone in the base of the urinary bladder, presenting complaints of burning micturition and pain in the lumbar region reported at the OPD of the Central Research Institute of Homeopathy at Kottayam, Kerala. So the patient was having urolithiasis complaints since 4 years and had undergone both allopathic and Ayurvedic treatment, but the response was not satisfactory. So after repertorization, so here the drug of choice was nitric acid 30C. So think constitution was prescribed 2 doses of this homeopathic medicine, proved to be effective. So suggested by Central Research Institute of Homeopathy, Kottayam. So next is a case report of a urinary bladder and bilateral renal calculi expelled through the homeopathic medicine Matsuomikia. It is a case report done by this Dr. D.Y. Patel Homeopathic Medical College and Research Center, Pimpri, Maharashtra. Okay. So case summary is a 34-year-old male patient was diagnosed with a large mobile urinary bladder calculus, and a small bilateral renal calculi with hydronephrosis is there, hydroureter is there, and mild edema at the UV junction, uretrovesical junction. He presented with recurrent episodes of mild to moderate, dull, aching pain, as well as sudden onset of severe, sharp pain on both sides of the flank and in the back. He also experienced the urge to urinate frequently. So, based on the characteristic symptoms, repertory analysis, and individualization, Naxomica 30C and 200C was prescribed. So, the treatment proved effective in facilitating the expulsion of all calculi and reducing edema at the UV junction. So, the modified Naranjo criteria. So, for homeopathy, a tool for causal attribution was used to assess the relationship between the homeopathic treatment and the outcome. So the monarch score for this case was +8. So this case demonstrates that a single medicine prescribed based on symptom totality was successful in the expulsion of large urinary bladder calculi, which may not pass spontaneously and usually require surgical intervention. The bilateral renal calculi were expelled and pathological changes in the urinary system was also resolved. The patient showed significant improvement in mental and physical symptom as well. So this is a good example for urinary bladder and the bilateral urinary calculi, renal calculi expelled through this homeopathic medicine, Naxomica 30 and 200. So next is the case report. This is the experience with the homeopathy in a case of large urethral calculi. So kidney we saw, ureter we saw, urinary bladder also we saw. What about urethra? Can we imagine urethral calculi? Okay. So the calculus in the male urethra is rare. So the word itself it is there, rare clinical presentation. And the case reports of urethral calculi in the medical literature are likewise scant. So this person, we report a case that is the government of NCT, New Delhi. Okay. So homeopathic practitioner, New Delhi. So this person is presenting a case. So we report a case of a 33-year-old male who presented a Delhi government homeopathic dispensary at Ali village with intense pain and scanty urination. Ultrasonography confirmed the diagnosis of urethral calculus in prostatic part of urethra. On the basis of keynotes, lysine prescribed in LM potencies improved urinary flow immediately and provided pain relief, which were objectively assessed as per defined scales. And the 11 mm calculus was expelled in 8 days. Wonderful. So no complications was observed during the following 6 months. Still more wonderful after expulsion of a large calculi. So this drug, on the basis of keynotes, lysine prescribed in LM potency improved this urinary flow immediately and provided pain relief. So it is a miracle of homeopathy. So this one is the clinical research, a multicentric observational study to ascertain the role of homeopathic therapy in urolithiasis, connected by Central Council for Research in Homeopathy, New Delhi, Regional Research Institute for Homeopathy, Jaipur, Rajasthan, Homeopathic Drug Research Institute, Lucknow, UP, Central Research Institute for Homeopathy, Kottayam, Central Research Institute for Homeopathy, Noida, Regional Research Institute for Homeopathy, Gudivada. So this abstract is this study was aimed to ascertain the role of homeopathic medicines in urolithiasis. A prospective study. It is a prospective study. Moving forward along with the time. Multicentric observational study was conducted by Central Council for Research in Homeopathy, CCRH, from October 2005 to January 2010. 6, 7, 8, 9, 10, 5 years. To find out the usefulness of homeopathic medicines in cases of urolithiasis. So 901 cases were screened, out of which 311 cases were enrolled and 220 cases were analyzed in this study. The symptoms pertaining to urolithiasis were assessed before and after treatment. pain, dysuria, and hematuria were graded from 0 to 3 as per severity of complaints. Calculi were graded as per number, size, and position of calculi. So the difference between the scores, some signs were used. Okay. So this, I'll come to this drug. So this lycopodium, the medicines found most useful were lycopodium clavatum in 40.9 percentage cases, then sulfur in 12.3 percentage cases, pulsatilla nigricans in 8.2 percentage cases, once again Naxomica in 6.2 percentage cases, and Cantharis in 5.9 percentage cases. So the treatment with homeopathic medicines showed positive response in dissolution or expulsion of calculi. So further validation of these results is needed by conducting RCT, randomized control trials. So I just now brushed up certain leading articles with their experiences. So end of the session, we are reaching this end of this webinar. So I want to just share you my personal experience. So this is a case of 9 into 5 calculi, lower ureter, not in the lower ureter. So 9 into 5, as everybody is aware, as I already mentioned in this previous areas. So it is a surgical case. See, next day, the patient showed me this picture of this renal calculi. So this is another case from Palani of Tamil Nadu. So it's a lady. So she photographed the stone which has passed out and has shared me that image or picture. So this is another one person who has greeted me. There is one kidney stone came out today. Many thanks for your treatment, doctor. Like it is in November 22, 2019. So he has WhatsApp me. So likewise, many patients will share their kidney stone pictures happily. So they are free from pain. Another image. So they will definitely share me the pictures. So see the streak of blood in the stone. Okay, so another case. So another case. So background the paper they have used. So another case, the same case. So another case. So 22. So this is another case. So this is another renal calculi. Background is newspaper. So this is another case. The calculi of size 9.2 is noted in proximal ureter. So this patient was suffering from pain, and this patient's son only came and collected the medicine. So the rest of the ureter is obscured, mild to moderate dilatation of pelvic and seal system is noted. Then he sent me this picture of this image. So that the previous ultrasound scan, he sent me the image, report image, and he came and collected the medicine. Next day morning, 8:35 a.m., the patient delivered this stone of 9.2 millimeter. I given a thumbs up at 8:41 a.m. seeing this picture. So there is a miracle of homeopathic treatment. So this is another case, 8 millimeter lower urinary calculus. Okay, so left kidney. So this is another case that is tiny calculi measuring 1.5 millimeters noted in lower pole of right kidney. Calculus measuring 6.3 millimeters noted in left proximal ureter, about 2.8 centimeter from the left PU junction with mild upstream of hydronephrosis. So we are running out of time. We'll rush faster. So, okay, so this is a calculi of size 9.2 millimeter noted in proximal ureter. Rest of the ureter is obscured, mild to moderate dilatation of PC, pelvic acid system are altered. Okay, so then left kidney is normal. So now I am entering into a recent case. Okay, so check the date of this case, 8/10/2025. That is last month. So today is the 16/11. So last month, 8/10, so a patient came with a calculi of 3 millimeters in a lower pole of left kidney. So inside the kidney only that stone is located, lodged on 8/10. So he want to return back to Australia, this patient who is doing a PG in Australia. So he came for vacation and the ultrasound, he revealed this stone. So on 22nd, 10, 2 days prior is boarding. He took a scan and that scan was taken in the same scan center. It is best scan center, Coimbatore. Same doctor only, Dr. Prabha Kumar. So he performed it nicely. So this is a current example. So on 22/10, so there is a normal scan of the abdomen. There is no stones in the kidneys. So both kidneys are normal in size. It shows normal echo pattern. So even though I am having some success, so I must tell you the failure in which area I'm getting. So that is in the Staghorn area, 100% is failure only. So this is a case of calculi of 11 to 12 mm from Bombay, reported from Bombay. Seen in the right upper ureter, about 3 to 4 calculi, 4 to 7 mm in size are seen in the dilated right pelvic calcium system. About 3 to 4 calculi, that is 5 to 6 millimeter in size, or Staghorn. Calculi are seen in the upper calyces of the left kidney. So Staghorn is very difficult. So the same case, CT is an example for CT for the same case. So after follow-up also, the CT KUB was done. So the same stands still. So few calculi noted the largest in upper pole measuring 13 into 7 mm. Proximal ureteric calculi measuring about 3 centimeter from PU junction. So, okay, so left kidney partial Staghorn calculi noted involving left upper calculi. So measuring about 2 into 1.2 centimeters. So I want to share this Staghorn calculi where failures we are getting. So last thing is prevention of recurrence. So the recurrence rates are estimated at about 10% per year, totaling 50% over a 5 to 10 year period and above 75% over 20 years. So this is an example for the original article, that is homeopathic preparation of Berberis vulgaris as an inhibitor of calcium oxalate crystallization. An in vitro evidence study has been done in the University of Madras, Chennai. Okay. So this person, Dr. Kalaisavi, has performed a in vitro study. So this materials and methods of spectrophotometric crystallization assay was carried out, and the slopes of the nucleation and aggregation phases were calculated using linear regression analysis, and the percentage inhibition exerted by the modifiers was calculated. So light microscopic observation of a CaO, that is calcium oxide crystals formed in the presence or absence of modifiers was carried out to support the outcome with spectrophotometric crystallization assay and to ascertain the potential role of Berberis vulgaris in calcium oxalate crystallization. So the result is the crystallization studies performed so far signifies Berberis vulgaris to be a potent drug against calcium oxalate crystallization, both at the level of nucleation and aggregation. So conclusion is our present findings add up to the experimental evidence to support the efficacy of the homeopathic preparation of the Berberis vulgaris in modulating the primary events of stone formation. So this is very important. So patient after getting rid of the stones or discharge of the stones, delivery of the stones, they ask us this next question is, I want to prevent further recurrence. So for that, we can go for this drug of choice. This is Berberis vulgaris, apart from their constitutional drugs. So this has been, in vitro study has been shown as an evidence to show that Berberis vulgaris as an inhibitor of calcium oxalate crystallization further. So last slide is this diet and end kidney stones. So okay, so this the diet for kidney stones. The persons who are suffering from kidney stones can have green tea, coffee, water with a lemon, lime, or orange slices, juices, bananas, papaya, etc., which you can see in the picture. Avoid high oxalate foods. Oxalate is leading to the stone formation, and calcium is leading to the stone formation. That is more than 500 milligram of calcium, vitamin D, 500 milligram vitamin C supplement, more than 500, they should avoid, etc., etc. So dark chocolate, etc. You can search in the net and get this diet and kidney stones image. So coming to the end card. So according to a survey conducted in India, 62% of the current homeopathy users have never tried conventional medicines for day-to-day health problems, and 82% would not switch to conventional treatments unless it is an emergency. So this is the feather in our homeopathy cap. Presently, homeopathy is accepted as a system of gentle healing. The inherent strength of this system makes it a safe therapy, eco-friendly, and free from adverse side effects. Thank you very much.
Thank you so much, sir, for such an impressive presentation. And the whole session was so informative. It's my request to all the attendees, if you want to ask any query or any doubt, we can have in a question and answer session. So, sir, Dr. Akansha is saying, thank you so much, sir, for wonderful session.
Thank you. Thank you. So if we no questions are there, we can leave the meeting.
Yes, sir. So next we have Zoish Patil is asking remedies for vesicular urethral junction calculi.
So as I already suggested, you can this PPT will be available in our Homeopathy 360 within some days. So you can go back to the so old treatment part I have given under homeopathy. So certain remedies I am suggested now. Apart from that, I have never tried any other medicines. Okay, so constitution you can try. Apart from that, organ specific remedies like Osmium Berberis vulgaris, Sarsapilla, like that also you can try. So still more effective, you can go for mother tinctures. They'll be more effective. So thank you.
So any other doubt? So Dr. Mohammed is asking, sir, what potency can be given Sarsaparilla?
And that's what I gave some examples now that literatures they are suggesting no 30 to 100 is enough. Mother tincture also you can go for. If depending upon the location size, we can decide your prescription. That is up to your choice only. So as I already given you the hint, so less than 5 it will automatically come out. So for that we can go for low potencies 30 to more. So 7 to 9 means still more 200. So more than 9 surgical cases, definitely surgical 10 and above means you can go for mother tinctures also. So there is a, anyway, ultimately we have to hold the patients and we have to deliver that renal stone. Then they will thank us a lot. Next.
So next question we have, sir, from Prasad Kulkarni. Sir, when we suggest to patient to take decision for surgical procedure.
So you can easily, and the first slide itself I showed, 15 mm delivered by some persons, literature is represented in this slide, no? So we can try first, we can try. So based upon previous histories, you can try. So if any failure is there, as I told you, the staghorn, I'm not having any hope. So definitely, I will suggest the future staghorn patients to go for surgery. Like that, you can decide among. It is your based upon your knowledge only. Coming to a quick decision. Any other? Thank you.
All right. Any other questions?
Okay, so we crossed the time 9, 10,
Yes,
9, 12. So
Thank you so much, sir, for your valuable time, and we have enjoyed your session very much. So, sir, few words would you like to say about your experience with Homeopathy 360 and what you think about this ongoing webinar series we are organizing for the students?
So, under this Homeopathy 360 banner, so this is the third participation I'm doing. So, first I did on January, there is a mental health and drug abuse and awareness program. Then next question and answer session for the exam going students during September, October month. Okay. So then this is a current session mainly for almost all the clinicians and homeopathic doctors, students. So this platform is reachable and easily accessible by almost all the homeopathic enthusiasts throughout India, alone I'm telling. So, and abroad also, they'll be feeling comfortable to join this 360 easily. So, link everything is easy. Only thing is if the person is having the Zoom app in their mobile, so automatically they can join this Homeopathy 360 anywhere in the travel also, anywhere in any part of the world. So they can join this 360. So this 360 is apart from this literature part, so has expanded its roots, branches everywhere, international level. So as a another thing I want to tell you is my patient who is now went to this US. She wanted to join this webinar like that. So many from there also from nook and corner of the world they can join this webinar. So this knowledge, as I quoted from Tirukkural, so it can be shared and learned only. So we cannot without sharing. I can also not learn. So that is a very precious thing, knowledge. So which should be shared and got back again. So for this sharing this knowledge, this Homeopathy 360 is doing a very tremendous work. So it is an exhausting work for you. So once again, I want to congratulate this team for organizing this webinar for me under this platform, Homeopathy 360. Thank you.
Thank you so much, sir, for your kind words, and we are always grateful to join you with us as a speaker. We are very grateful, sir. Thank you so much.
Thank you. Thank you. Good night.